Welcome to the Doctors In. I'm Dr. Freddie Gomez. So, doctors all over the world have been trying their best to discover possible cures for COVID-19, especially in countries that have been greatly affected by the pandemic. Kasama na po dyan ang Pilipinas. Since matagal ma-develop ang isang viable vaccine para sa COVID-19, one solution that experts are looking at is something called convalescent plasma therapy. Ito ay kung saan gagamitin po ang sariling antibodies ng tao. Today in the program, we will know more about this treatment and how it might potentially curb and eventually we can take control of the COVID-19 pandemic. So to discuss more about this topic, we have in the program Dr. Jonas del Rosario. He is the spokesperson for the Philippine General Hospital, and PGH is among the hospitals qualified to do convalescent plasma therapy. Welcome to the program, Dr. Del Rosario.
Magandang hapon po. Thank you for having me.
Dr. Jonas, could you explain to our viewers what exactly are plasma antibodies?
Okay, the convalescent plasma therapy is a process wherein we take advantage of the antibodies that have developed or the donor or the survivor of a certain illness has. For example, let's say here in COVID-19, someone who has recovered or survived from this illness will have antibodies because his immune response was able to fight off the disease and he was able to produce antibodies. So from the antibodies in his plasma now will be used to help another patient who's still trying to fight the disease. So there will be a recipient who, in this case, in our scenario, we're giving it to those who are severely or critically ill. We use the plasma of someone who has already survived or has fully recovered from COVID-19, taking advantage of the antibodies in his plasma.
Ngayon, Dr. Jonas, is this a new type of procedure or has this procedure already been used several times, several years ago? Nagamit na rin ba ito sa mga ibang mga pandemic? Kumaga proven na ho ba itong convalescent plasma therapy?
Tama po. Yung convalescent plasma therapy is not something new. Noon po, nung mga ibang mga pandemics involving respiratory viruses, example was the 1918 Spanish influenza, the H1N1 swine flu, the MERS-CoV, the SARS, even in Ebola. Plasma therapy has been one of the treatment regimen being used. Again, this is a form of passive immunity being given to a patient. So meron na yung mga experience in the past. Of course, this is something new because yung COVID-19, bago pa lang. So, but we take advantage of the historical data, the results, the good results of previous pandemics wherein plasma therapy was used.
Now, Doctor, how is how is this extracted and it's administered to the patients?
So, a patient will undergo blood donation, just like what you're seeing probably in the picture. They will donate. There are two ways of donating. The one that we actually advocate is they will donate through plasmapheresis, wherein blood is being donated and then it goes through a machine, and the machine will filter out and separate the cells from the plasma. And so what will happen is the donor will be donating really the plasma, and the cells will be retained, will be given back to the donor.
Now, why should we use the antibodies of patients who have recently recovered from COVID-19? Is there a difference if the antibodies were extracted from a patient who has recently recovered versus a patient who has been well for several months already?
What we need to make sure of is the donor already has developed what we call IgG antibodies. So it can be as early as 2 weeks from the onset of from being well to even a few months after, as long as they have the IgG, the antibodies, which means that the patient has fully recovered and has some kind of immunity to the disease.
Ngayon, I'm sure a lot of people who are watching have a lot of questions with regards to antibodies, anong klaseng therapy po ba ito, gaano ka-effective ba ito with regards to COVID-19. Ano? So let's try to answer some of them. First, we have a question from Michael Angelo Manalo. Ang sabi niya is there any advantage in using plasma therapy in comparison with experimental antiviral treatments to tackle COVID-19?
Those are two different treatment regimens. No? Of course, in the treatment of COVID-19, we try a lot of medicines and treatment regimens because there's no known cure at this time. So in COVID-19, in the management of COVID-19 patients, there is a place for the antivirals. We're giving that also. And then plasma therapy is another mode of treatment. Now, the way that we are using the plasma therapy now is under compassionate use. And so we only give this to patients who are severely to critically ill.
Okay, I think that's one thing that's very important, Dr. Del Rosario, that this plasma therapy here in the Philippines is given to those who are severely or critically ill. Ngayon, for those who are given the plasma therapy, kamusta naman na Dr. Del Rosario ang outcome? How long is the recovery period when a patient receives this plasma therapy?
The recovery period is variable. We observe them from the time they receive the plasma. So far po, in the Philippine General Hospital, we had 6 adults who received plasma. A lot of them were critically ill. 3 out of the 6 are recovering or are stable. Unfortunately, 3 of those did not make it.
Okay. Now, let's answer some more questions online. So please, patuloy lang po ang pagpasok ng mga tanong ninyo online sa CNN Philippines Facebook page. Si Lalaine is asking, gaano karaming beses pwede mag-share ng plasma ang isang recovered patient? May certain limit po ba? Magandang tanong po ito.
Okay. Kapag po ang dinonate ng isang tao ay purely plasma, pwede po siya mag-donate every 2 weeks. Kung po yung nag-donate naman siya, yung regular donation na yung whole blood, pwede po siya mag-donate every 2 to 3 months.
Ngayon, a follow-up question to that, Dr. Jonas, sa isang taong nag-donate ng dugo, gaano kadaming beses ito pwede makatulong sa isang nangangailangan? Kumbaga, ilang beses pwede gamitin yung dinonate na dugo para sa convalescent plasma therapy?
Okay, so usually po, depende po sa regimen or sa protocol. Yun pong ginagamit namin sa PGH. Ang isa pong donor na makakapagbigay ng 500 cc ng plasma, yun po ay magagamit sa isa ring recipient na halos kasing laki niya ng 500 ml din. May mga situation po that the 500 ml or even 600 ml that was donated by someone can be split into 2, lalo na depende po sa condition ng mga pasyente. May iba po, half dose lang po ang binibigay, mga 250 ml. So in that case, if you donated 500 ml, you will be helping 2 patients.
Okay, very good. Ngayon, we have another question from Cecilio who asks, will it not compromise the donor afterwards? So, kamusta naman daw po, Doktor, ang nag-donate ng dugo pagkatapos siya mag-donate? Kamusta ang kalagayan naman nila?
Okay, yun po, first of all, when we screen our donors, we have to make sure that they are doing very well. Sila po ay fully recovered. So malakas na po sila, bumalik na ang pangangatawan. Secondly po, we actually do a screening blood test, making sure that they do not have any blood-borne infection in their blood. At the same time, we have to make sure they are not anemic, their hemoglobin is normal. Tama rin po yung platelet count. Now, after that, we have to make sure, as verified by the physician, that they are really healthy and they're asymptomatic. Now, kadalasan po, so far po, sa 19 patients na nag-donate sa PGH, pinagmamasdan po namin sila, ino-observe, wala po nagreklamo sa kanilang nahilo, nagkaroon ng side effects. So, we get only about 500 cc of blood, which if you are donating blood, that's really not so much. And most of the time, our patients are doing well after the donation. We make sure that they also tell us if they're feeling something. Wala pa po sa 19 patients na nagka-problema.
Sa opinion nyo, Dr. Del Rosario, no, ngayon na nagagawa na rin po natin ang convalescent plasma therapy, paggamit ng antibodies ng mga gumaling na mga pasyente. So tingin nyo yung ganitong proseso ay enough na para ma-lift ang mga ban, makabalik na ang mga tao sa kanilang buhay, kumbaga, for all of this social distancing to end and everything. Sa tingin nyo, is this enough?
Hindi po. Ito pong treatment ng convalescent plasma therapy, I just want to clarify, hindi po ito yung proven na ito na yung kasagutan sa ating paggamot sa COVID-19. Ngayon po ay experimental pa rin. Ang aming pong paniniwala ay makakatulong po ito sa pag-recover ng mga pasyente. This is an adjunctive treatment, we call it. So it complements other treatments, but it's still not, the evidence is not yet very strong that this is indeed very effective. Kaya nga po namin ino-obserbahan. One thing po that we plan to do is to consider under a clinical trial or a research study wherein we will be giving plasma much sooner or much earlier to those who are not severely or critically ill, but rather to those who are only moderately ill. So earlier in the game, we will be giving plasma. So in the hope that the patients will not deteriorate further, by giving the plasma earlier, mas maaga po, ang aming paniwala ay hindi sila mapupunta sa ICU, and we will promote faster recovery.
Okay, we have to take a quick break, but when we return, let's discuss the process of plasma donation at kung saan dapat pumunta ang mga dapat at kung ano ang dapat maasahan sa prosesong ito. Stay tuned. The Doctor is in. We'll be right back. And we are back in The Doctor is In. I am Dr. Freddie Gomez. So you're watching The Doctor is In on CNN Philippines and on Facebook Live. So earlier, we talked about the convalescent plasma therapy and how COVID-19 patients can benefit from it. So still with us is Dr. Jonas del Rosario. Siya po ang spokesperson ng Philippine General Hospital, at ang PGH ay isa sa mga authorized at qualified centers for convalescent plasma therapy. So Dr. Del Rosario, continuing with the conversation, merong mga instances na isang pasyente gumaling sa COVID-19, ngunit after some time, nagka-COVID-19 ulit siya. Kumbaga nagkaroon siya ng reinfection. So maraming nagtatanong, bakit ito nangyayari kung akala nila may antibodies na sila at protektado na sila sa COVID-19?
Magandang tanong yan. Alam mo, medyo iniisip namin kung bakit ba pwedeng mangyari yon. Ang mga possibilities po ay, to begin with, hindi pa naman po talaga sila magaling. At maaring yung test na negative, na COVID-19 negative, might be a false negative. And then nung inulit yung test ay talaga namang COVID-19 positive pa sila, so hindi pa magaling. So in that case, there might be an issue on the test itself. Pangalawa po, medyo inaaral pa rin po ng iba yung ano nga ba itong antibodies na to. Ito ba ay protective talaga? Ang sa amin po, when we look into our donors or patients who have fully recovered, it is not enough that we rely on the test being negative because we require a patient to give us a result of being negative in the RT-PCR, no? Yung PCR test po. But we examine them, we ask them for symptoms, we have to verify if they're really fully recovered. So medyo hindi po, there's always been an issue. Is it relapse? Is it reinfection? Right now po, it's not very clear to us. But so far, of the patients whom we have screened, when they say they are fully recovered, we look at them clinically and very consistent mo na sila po ay magagaling na.
Now, Doctor, let's go on to kung paano yung proseso ng pwede mag-donate ang mga tao ng kanilang plasma, no, kanilang dugo. So what are some of the ways na pwedeng mag-donate ng plasma? Sa PGH lang ba pwede mag-donate?
Hindi po. There are other hospitals now that are doing the convalescent plasma therapy. St. Luke's Medical Center, both in QC and in Global City, was also doing this almost at the same time as PGH did. And then there are a few other medical centers which are also doing this, some of the major medical centers. So hindi lang po sa PGH at sa St. Luke's, may iba pa po. Now, in PGH, what we do is we have this hotline, which is 155-200. So we call on COVID-19 survivors, we call them, or those who have fully recovered from the illness. They call this number, and then yun po, there will be an interview that will happen on the phone. May screening na po dyan. And then because we have a criteria for donation.
Okay, so again, that number is 155-200, ano, para dun sa mga nag-recover at willing silang mag-donate ng plasma nila for the antibodies. Now, let's answer some questions from our viewers online. Ano? Meron tayong tanong from Maan. May restrictions or criteria po ba yung plasma therapy, like blood type, age, and so forth?
Kung ang pinag-uusapan po natin ay yung restriction sa magdo-donate, meron pong mga criteria. So we made sure obviously that they have recovered from the illness. So from a COVID-19 positive PCR test, we would like to see a COVID-19 negative PCR test. 2 weeks of full recovery without symptoms. Their weight should be at least 50 kilograms. Their blood screening should be negative for blood-borne infections such as HIV, hepatitis, syphilis, and malaria. Their hemoglobin should be high, at least more than 12 grams per deciliter. So yan po yung at least dun sa initial na criteria for the donor. For the recipients, wala naman po na age as long as they are really critically or severely ill. Both the donor and the recipient should give us informed consent. Okay? Kailangan po yun. Now, as to the blood type, tama po. Plasma transfusion is almost like also getting blood. So, kaya may type specific po. So, we match the donor and the recipient. May blood typing po or cross-matching na nangyayari.
Okay, so before we continue, we'd like to thank those who are watching The Doctor Is In. We have audience coming from Nigeria, Texas, Lebanon, and viewers from different parts of the Philippines. Thank you very much for joining The Doctor Is In. I am joined with Dr. Jonas del Rosario. Siya ay taga-PGH, who is one of the institutions performing convalescent plasma therapy. Ngayon, Doctor, ang mga senior citizens po ba na nag-recover sa COVID-19 ay pwede rin mag-donate kung sakasakaling gusto nila?
Pwede po as long as they are healthy. One exclusion criteria which I think I failed to mention is patients who have significant cardiovascular disease, uncontrolled diabetes, hypertension which is really moderate to severe, someone who has recovered from cancer. Yan po mga medical illnesses or conditions po that will exclude a donor. Kaya in general po, pag senior citizen, alam naman po natin maraming comorbid conditions o sakit. So we really have to screen them.
Okay. And we have another question from Queenie. Ang tanong niya is, para sa mga donors, how much blood should be donated and what is the shelf life for donated plasma?
When we do the process of donation, 500 cc of blood is taken out from the donor. Most of the time, it's 500 cc. But it is partly dependent on the size of your vein, your body weight. Okay, so we have had patients or donors who are able-bodied, medyo malalaki katawan, malalaking tao. They were able to donate as much as 600 cc. Meron naman po kami, we have some na medyo maliit ang ugat, medyo petit sila. They were able to donate about 400 cc. Average is about 500 cc. Now, as to the shelf life, as long as they are put in the blood bank at a certain temperature, the plasma can be preserved up to about a year.
Okay. And here's an interesting question, galing kay Christine Ann Belando. Ang tanong niya is, has the therapy been tried on COVID patients with mild symptoms? Will the therapy work faster on patients with milder symptoms? I think you touched on this a little bit earlier, Dr. Jonas.
That's a very good question because what we are doing now is compassionate use, and we're giving it to the severely to critically ill, which some people are saying might be too late in the game. So now we're really, we have a protocol, a research proposal, which is still being reviewed by our institutional review board, wherein we will give the plasma to moderately ill patients. I'm not sure about mild because mild, madali lang makarecover. But at least moderate. They're not severely ill. They're still okay. They're able to, they don't have to be admitted in the ICU. But yes, the thinking is if you give them early to this moderately ill, then they will not even go to the route of being severely ill or going into the ICU. So that's really the plan, to give the plasma earlier to those who are not badly affected by COVID-19.
I'm sure a lot of people, including myself, would be looking forward to that step, Dr. Jonas. Now, we have another question from Eleanor, who is asking, sino po ang pwedeng mag-donate? Pwede po ba mag-donate ng plasma basta healthy pero hindi nagka-COVID?
Hindi po. Kailangan po nagka-COVID-19 kayo kasi po kung hindi po kayo nagka-COVID-19, wala po kayong antibodies na kailangan natin dun sa plasma. Kaya nga po, in a way, yung COVID-19, having COVID-19, minsan po ay nagiging blessing dahil nakakatulong po yung mga pasyente o mga taong naka-recover sa COVID-19. So we tell our donors, this is probably one way of getting over the stigma of the disease because you alone, because ikaw ay nagka-COVID-19, you are the one who's qualified to donate blood.
So far, do we already have figures, Dr. Jonas, or an idea kung gaano karaming naka-receive na ng convalescent plasma therapy dito? Or at least, ilan ang dumaan sa PGH?
Sa PGH po, just like what I said, sa PGH po mismo sa adults po namin, we had 6 recipients. Tapos po, there was a time when we had to give some plasma to some patients from another hospital. So we gave one to Manila Doctors and we gave a couple to Asian Hospital. As far as I know, in St. Luke's Medical Center, when I listened to their report yesterday on TV, I think at least they already gave plasma to 12 patients. Okay? So I can only speak for our outcome. So sa PGH po, 3 out of the 6 are doing okay. They are recovering. They got plasma therapy. unfortunately, the half, 50% not able to make it. Doon po sa mga pasyenteng nabigyan namin outside of PGH, 2 out of the 3 are recovering or are stable.
Okay, so hopefully tumaas ang mga number na makaka-avail pa ng plasma, convalescent plasma therapy. Now, before we go, Dr. Jonas, do you have a message for our viewers?
Yeah, thank you for the opportunity for allowing us again to make a pitch on inviting our fellow Filipinos, mga kababayan po natin, those who had COVID-19 and were lucky enough or are lucky enough to survive and recover fully from the illness. Your blood, specifically your plasma, has antibodies which can help another patient who is fighting for their life. So you have a gift of lives. You have in your blood antibodies that may help extend the life of someone.
Very well. Thank you very much also, Dr. Jonas del Rosario, for your time and sharing with us a very important information about plasma donation. And thank you also to the viewers who sent in their questions here. Sana po ay nasagot namin ang inyong mga tanong. So please do join us again on The Doctors In on Monday at 3:30 p.m. only here on CNN Philippines. I'm Dr. Freddie Gomez. Have a safe weekend, everyone.